So, as the Premier has indicated, the national plan for opening in Victoria and the Victorian roadmap based on the 80% vaccinations for 16-year-olds and above will be achieved on all the projections that we've got by this Friday, the 29th of October. And as a result of that, from 6 p.m, the public health orders will be changed as per the Victorian roadmap that we distributed over a month ago, and with some further easings. So, as a result of that, just to refresh everyone's memory, most indoor settings, that's restaurants, pubs, gyms, hairdressers, all will open with no caps, subject to a 1 person per 4 square metre limit, if all staff and patrons are fully vaccinated. So you get access to these settings if you are fully vaccinated as both a patron, a customer, and as a employee and workforce. In regards to most outdoor settings will remain at 1 person per 2 square metre limit up to the 500 people limit, where both staff and patrons are fully vaccinated. Indoor and outdoor settings will also be covered by those density quotients as well for things like weddings, funerals, religious gatherings, again, if all persons are vaccinated. Entertainment venues will reopen for indoor seated venues. That includes cinemas, theatres, and they will operate at 75% capacity for 1 person per 4 square metres, up to 1,000 people. For non-seated entertainment venues, that will be 1 person per 4 square metre with no patron cap. Outdoor seated and non-seated venues will include stadiums, zoos, tourism attractions. They'll all be at 1 person per 2 square metre limit, up to 5,000 people, again where staff and patrons are fully vaccinated. Events, including music and festivals, will be able to host up to 5,000 attendees, subject to the restrictions that might apply to that venue. The Chief Health Officer may also grant approval for larger crowds, for significant events, and for venues under the public events framework that so many of those venues have become used to over the course of the pandemic. As the Premier has indicated, masks will remain mandatory indoors, but are no longer required outdoors, particularly where social distancing can be achieved. It will be highly recommended that you continue to wear face masks where you cannot physically distance in those circumstances. In regards to regional Victoria and metropolitan Melbourne coming together under the one set of public health rules, that will of course mean that Melburnians can travel to regional Victoria and indeed interstate, subject to those interstate rules again. I just also wanted to touch on vaccinations and seeing the vaccination milestones continue to topple at record rates as more and more Victorians come forward to both look after themselves, look after their community, but also to make sure that they can be part of this opening up and returning to something that looks like a COVID-safe normal in 2021 and on into next year. Just to reflect that something like almost 80% of our 12 to 15-year-olds have now received at least 1 dose of a COVID vaccine. These kids only became available for their vaccine 42 days ago, and they are on the rate to essentially meet the same as the over 18 goals that we've set. We do have some 340,000 second doses to achieve in our vaccine target to reach that 80% double dose for people aged 16 and above, and every indication is across all of the platforms that people are coming forward at in increasing record numbers, that we should achieve that on Friday. On average, over the past week, we've landed something like across our GPs, our pharmacists, our community health and our state hubs, something like about 100,000 doses a day, and some of those, 60 to 70,000 of those are the second doses as people go through the vaccination journey. And I want to thank all of those people, and I equally want to thank our GPs, our pharmacists, and all of our support staff and clinicians at our state-run clinics who have really been working so hard. And just to recall that when it comes to the state-run clinics, the original Commonwealth plan had us doing about a quarter to 27% of the vaccines across the state. No state clinic system has delivered anywhere near the numbers that the Victorian state clinics have, and we're pushing around about half of the total vaccines over the course of this year have come from our state-run clinics, and I want to thank them. We're also seeing many school pop-ups and local community mini vaccination pop-ups right over the place, particularly in those areas that continue to be of greatest concern for us in the southeast, in the north and in the west, and across those high-risk communities. At the moment, we're including Hampton Park Secondary College in Casey, where the doses are almost now up to 95%, and second doses have passed 70% in that community. We have 17 school pop-ups operating over the course of this weekend, including in Cranbourne West, Frankston North, Melton, Mildura and Box Hill. And I'd urge anyone in those communities to hop onto the website. You can just either book or increasingly just show up. But if you're yet to be vaccinated, now's the time to do it. We also have bicultural and multilingual interpreters operating on site at Richmond High, Reservoir High and Melton Secondary College, amongst a range of others, as we really do seek to push the boundaries to get to that 80, 90 and indeed beyond % of people having the opportunity to be vaccinated. We're currently running 10 community-based mini pop-up sites at that really granular local community level in areas where we need to just put in that last big effort to get people vaccinated. You can just walk up and get vaccinated at any of the following amongst a range of others. There are 3 Degani coffee shops, the one at Broadmeadows, the one at Plenty Valley and Roxburgh Park, and of course you also get a free coffee. There are 4 Headspace centres popping up over the course of this weekend and the next few days to encourage young people who might be distant from normal service delivery programs to come forward and get vaccinated, and they have been very popular. With currently running those out at Sunshine, Glenroy, Frankston and Greensborough Headspace. But of course, we're not there yet. We are so close to achieving these significant milestones and the relaxation of the public health orders that go with it. And we have to, as a result of that, when we do achieve these benchmarks, it's not over. We have to keep mindful of the fact that there are active chains of transmission out there in the community, and we were within, so far, the boundaries of what we thought might be the cases in our hospital system and in the boundaries of what we need to do to assist our healthcare professionals to manage that COVID normal across our community. That's why it's so important that people continue to get tested during the course of this continued opening up, because the reality is there continue to be more cases than ever in our community. But this is a question of normalising and making sure that our health system copes with the continued transmission, hopefully of declining cases, as more and more people get on top of outbreaks through vaccinations. but testing continues to be important. So please, the message of if you think you've got even the slightest symptoms, even if you are fully vaccinated, the chances of you getting very unwell are hugely diminished, but there is still the chance that you may be able to acquire and pass on the COVID-19 virus. So it is still important to come forward and get tested. We are continuing to concentrate our efforts, therefore, on testing and vaccination as a rolled-up package in communities including Casey, Melton, Wyndham, Greater Dandenong, Whittlesea and Hume, where we know there continue to be significant active cases across our community. But the same applies anywhere in Victoria. Those vaccines, they protect us, they protect our families and our communities, and getting sure that we're ahead of this through testing is the other part of the equation. So please, whilst people are out enjoying family, friends, and the opportunities that getting together provide us in the Victorian community over this weekend, and indeed once we hit 80% on Friday and beyond, it is still important to make sure that we have the COVID-safe plans in the forefront of our minds. Remember that as people come together, there are still the opportunities to do that safely, to protect yourself and each other. It's only when people come forward for those vaccinations to get us to 80 and beyond and into the world of 90 and potentially beyond that the freedoms and the opportunities that the Premier referred to will be part of our daily lives. It's up to us all to do our bit to get there. That's when we can enjoy all of the things that we like as Victorians and that we love as Victorians, not the least being a Christmas where we can come together as families and communities and move into 2022 in the safest possible way and come back to the kind of COVID-safe life that we all look for again. Your vaccination is the ticket for that. Each and every vaccination is another step on that pathway. And I want to thank the Victorian people for their outstanding efforts in getting us to these last two milestones. And can I take this opportunity of thanking yet again our healthcare workforce, our nurses, our doctors, our AMBOs, our paramedics, everyone who is working incredibly hard now into their 21st month of this global pandemic, and who all Victorians need to continue to keep in the forefront of our mind as to how we support them. We support them by getting vaccinated and staying safe as we reopen and look forward to a safe 2022 and beyond. Thank you.